Hi guys, Alicia So Awesome. Okay, I have some quick advice for new nurse practitioners out there. I am an acute care nurse practitioner, so a lot of what I say is relevant to my practice, but I think the tips and stuff that I give you guys to shine in your nurse practitionerism will help all NPs. The first thing I'm going to tell you guys is make sure your assessment skills are up to par. These physicians rely a lot upon us. They really are just overseeing what we think we should do with the patient, right? So you set the plan of care. The physician oversees that and is going to yay or nay, or in my case, or most cases on my service, add to the plan or take away, because sometimes I just try to do the most to make sure I'm not missing anything. But if you are a new nurse practitioner, I'm 2 years in the game. If you're new or somebody that has been an NP for a while and still trying to find a job, I'm going to tell you guys that the best thing you can do, one of the best things you can do is make sure your assessment skills are up to par, because the physician is going to be drilling you like crazy about what you saw in your assessment and what do you want to do, right? So your assessment is how you come up with your plan of care, and they want to know all the things. So make sure that your assessment skills are up to par. The next thing I want you to do is, I know I am an aggressive, just nurse, period. I believe strongly in what I feel about the patient, and I'm going to voice that to the physician at all times. So what I'm going to tell you is make sure that you have a good foundation with your physician you're attending. Make sure you guys have good communication skills, because I feel like in all aspects of the care for the patient, everybody wants the better outcome for the patient, and you're going to feel passionately about whatever plan of care you come up with. So make sure that your relationship with your attending and with your surgeons, or even with your consults, right? Like I'm trauma, we consult ortho a lot. Make sure you build a good rapport and a relationship with those people, because ultimately you guys want what's best for the patient, and that's the best outcome. Number 3, I'm going to tell you guys to also make sure that you are crossing your T's and dotting your I's. Make sure that the plans of cares and stuff that you're putting in, make sure that the nurses and the supportive staff are fulfilling them. For instance, like Q2 hour turns on your spine patients are extremely important, right? Stuff like that, making sure that the labs and stuff are getting done. This is something that when I became a new NP, I didn't know I had to do. I put the orders in and I go about my business, right? It was through trial and error that I would come in and labs wouldn't be done and stuff wouldn't be done, and the nurses would be telling me like, I didn't see the order, or I wasn't for sure what the order was. So make sure that you are make sure that the plan of care that you're putting in, that they're getting done, right? That all the supportive staff are doing what they are supposed to do. The 4th thing I want to say is make sure you have a strong relationship with your nurses. I think for me, I'm super duper, serious about making sure my patient gets the best of the best. And if I could go back and change anything, I would make sure that my relationships with all my bedside nurses were very good, or at least to the point where I can make sure that they're doing what they're supposed to do for the patient. Your bedside nurse has their eyes on the patient more than you do as the provider. So you're going to need them to be on team. You're going to need them to feel comfortable in communicating with you. You're going to need them to feel like they can talk to you so you can know what's going on with your patient. That is a very big, very, 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 very big for you guys to understand. I'm the nurse practitioner that stays on the floor with my patients. My office is up on one floor, and our patients are on other floors. I stay on the floor with my patients because I'm overbearing and I want to know what's going on, and I never want the nurse to tell me she couldn't contact me or didn't know. I'm right here, so I try not to miss anything. But definitely make sure that your relationship with your nurses and your supportive staff are up to par. They have their eyes on the patient. They're going to be able to tell you what's going on when you're not able to, when you're not having your eyes on a patient, and stuff like that. What else can I tell you guys? It's also a good idea to have a good relationship with the C3s and the social workers, because they're going to be the ones that are moving the patient out of the hospital, right? They play a very important role, and they're going to be hounding you about durable medical equipment paperwork, and when can the patient get out, and when can they be medically clear, and are you guys done with surgery? Can we get physical therapy on board? They can kind of be aggressive because they're trying to get the patient out. If you guys work together as a team, it will ultimately be better for the patient. So always make sure you have a good relationship with the social workers and the C3s. This is Alicia So Awesome. These are tips for the new nurse practitioner. Yeah, I'll see you guys soon.